Well, time is running out for Congress to renew the children's health care program known as CHIP. Several states around the country are running out of money after the deadline to renew that program came and went without any action in September. 7 News reporter Dave Jordan is joining us live here at 7 on Main with details on how this is playing out locally. Dave.
Well, Amy, millions of children across the country, including right here in South Carolina, use CHIP as their medical provider. Many are now trying to figure out an alternative as CHIP is not reauthorized. The program, often described as Medicaid for children, has been in place since 1997, and it's been a literal lifesaver for families across the country.
It's been a quick and easy bill to pass. It's been bipartisan. No one's resisted it. As I understand, about 3/4 of the public want this thing approved.
But funding and time are running out for CHIP, which until recently was widely supported by both political parties. 9 million children receive coverage through the Child Health Insurance Program. 75,000 of those kids are in South Carolina. The program was last reauthorized in 2015, but Congress allowed it to expire in September, leaving the future of CHIP up in the air and millions of families on their own.
They're basically going to have to rely on some combination of charity and perhaps getting into Obamacare with subsidies that are still part of the program.
Neil Caesar with the Health Law Center says some states could see funding run out as early as February.
1, 2, 3.
But Maggie Cash with South Carolina's Children's Hospital Collaborative, who advocates on behalf of CHIP, says South Carolina has some wiggle room.
Should Congress fail to fund CHIP, the state will be in a position that they will have to move South Carolina's CHIP program into the Medicaid program.
That's because here in South Carolina, CHIP operates as a Medicaid expansion program. Cash says she has been in contact with the state's congressional delegation and believes we could see a reauthorization as early as next month.
All indications that I have is that everyone thinks it's going to get done, and it's going to get done in some sort of package in December.
Now, what's not clear, Amy, is whether or not this will be part of some sort of a tax bill or some other package that needs to clear committee, as the tax bill just cleared committee is going to be voted on by the broader Congress. But it will pass in December. That seems to be the consensus from all parties involved.
So there's not panic, and they do seem to have hope
Right.
that one way or another they're going to be able to provide services to our kids?
Right, they do. I mean, because as she said, it's covered under the Medicaid expansion program. So worst case scenario, South Carolina loses CHIP. Those children will automatically slide into Medicaid coverage, and then they'll work things out and then they'll pass it. We're told that if it passes as part of a broader measure, it will not be part of the individual mandate that requires people to buy health care. That is off the table because that is not a bipartisan measure, but by all accounts, CHIP is.
All right. Dave Jordan live tonight. Thanks, Dave.
Sure.